Hey, Tony, thanks so much for joining us today. Really happy to have you on here to talk a little bit about compliance, Specialty One, AI, and everything in between.
Great. Happy to be here, Richa. Thank you.
Awesome. For everyone else, this is Tony Manderschied, the Chief Compliance Officer of Specialty1 Partners. He's also a compliance client and a user of one of our AI agents. I would love, Tony, to give you the floor to introduce yourself a little bit and your background.
Sure. Thanks, Richa. So brief background on me. I've been with Specialty1 Partners since June of 2022. It's a pretty new company. We are a DSO that provides essentially back office support services to approximately 230 endodontist, periodontist, and oral surgery offices across the network. When I came to Specialty1, it was we had the real basic framework in place for some of our things, some of our components, but I was really the first person with a compliance officer role for the company. So a lot of my time was spent just getting the foundational components of a traditional compliance program in place, and then working on how we want to structure both internally our department and how we want to really convey how we operate to our clients, who are the offices and partner doctors in our network. Prior to Specialty1, I was spent around 7 years or so with a smaller DSO. It was a general dentistry DSO with about 70 locations in a dozen states or so. I was there for 7 years, and prior to that, I spent most of my career in acute care health system compliance, Medicare compliance, Medicare conditions of participation, running the 7 elements of a compliance program in various hospital settings, physician practices, home health, large academic medical centers. I've seen a lot of been in as many as, large as 900 bed hospitals down to the small critical access hospitals that are out in the sticks of our country. So a lot of various experience, but I really enjoy dental and really enjoy the industry and really enjoy the problem solving that comes with this space. It's a pretty new space that we're in, and that creates some new challenges for us, but that's what I enjoy doing. So
Awesome, Tony. It seems like in all of the roles that you're in, and I know at Specialty1, it's quite a decentralized compliance canvas that you have to cover. So, for example, you mentioned the number of practices that Specialty1 has under its wing, and basically you are in charge of making sure that all of them are compliant and making sure to follow up on that. And it seems like you've done that in every role that you've had before, based on what you just said. And so can you talk a little bit about the challenges of something like that versus, a more traditional, let's say, health tech or health system where you're just kind of focused on a more centralized compliance environment, if that makes sense?
Yeah, of course. I think from my perspective, when I reflect back on really the key differences between what you've described, a centralized kind of four walls hospital compliance program versus, having an office, 230 offices in 28 states. The key difference from my perspective, even outside of sort of the dental versus acute care health system, which we can obviously get into if you'd like, is that decentralization and the challenges that come with that. And I think the biggest challenge that we face is just communication, right? We've got almost 200 office managers spread across the country. And how do we effectively manage and communicate compliance program standards, risk management results of our risk management reviews, which we can get into in a little bit later too, if you'd like to, and then really conveying back up centrally to our support center and our executive team, our board of directors, how things are going and where our risks are and what we're doing to get them addressed. And that's really the challenge that comes with a really decentralized platform um, that's very different from your traditional four-walled hospital.
Mm. That communication, what are some of the ways in which you've seen that be most successful? Because that's a really difficult task. Also, because I imagine that the folks who you're communicating with, these are the practitioners on the ground in these, offices and practices, and they have a lot going on for them. And this may not be their number one priority. So how do you make
Yeah,
them
but
care?
that's a great question. I think one of the things we spend a lot of time in the beginning of kind of when we were really starting to dive into how we want to structure a program and communicate these things. We really spent a lot of time on messaging,
Mm,
and we've really positioned ourselves to act as a resource for managers and the operations teams that support all of those offices across the country. And we really are very careful about how we convey our findings, and we
mm,
convey them in a way, again, that's not a gotcha kind of situation, but
mm,
more of a here's what we think is a problem, and we provide solutions to those problems. And we really spend really focus on really trying to take some of that administrative burden off of the office managers and off of the operations teams so they can focus on the patients. That's
mhm,
really been the key differentiator for us. And it's been very successful, I think. I think we've established very good relationships across the network with that sort of framework that we've put together. And I'm still surprised today at the amount of or lack of, for probably a better term, lack of pushback, right? And it was refreshing to me as we sort of went out and started our work that a lot of these office managers, if you think about it, a lot of these office managers prior to joining Specialty One were sort of off on their own, on an
mm.
island by themselves, having to figure things out by themselves. And then
Sure.
Specialty One comes along, and it's a completely different world for them. And it's probably very nerve-wracking for them, right? To now we're part of a larger network. What does that mean for me? How is my day going to change? So we've really took that and really said, okay, now you have to worry about less things,
Mm,
right? And that's really gone a long way to kind of bridging that gap between, you know, what you typically or could see, or maybe the better word is reputation of compliance. A lot of people view it as especially if you don't come from an organization that had a compliance program, they're viewed as sort of the policing arm of the company, and we don't want that. We want the opposite. So
mm. One thing I'm interested in is just it sounds like these are the communication piece that you mentioned and some of the other levers of, focusing on messaging this as something that is less of a lift for them, right? These are
yeah.
ways that you have essentially helped your control owners, for lack of a better term, understand, why compliance should matter for them.
Mhm.
Is there any, I guess, learnings that you've seen have changed your approach over time? Like, did you start with that always, or how did it evolve?
We really started with that. I think it's ingrained in the culture of the founders of Specialty1 Partners. But we're here to support our offices,
Mm,
and everything we do every day should be sort of under that sort of understanding that we're all here to support those offices and support the success of those offices.
mm,
So it's been we've just sort of took that and ran with it in the beginning, and I think it's been super helpful for us, particularly when I think on the we didn't really talk about sort of the inner workings of the department here, but we have really two arms of our department: clinical risk management and regulatory compliance. As you can probably know, regulatory compliance, OSHA standards, Department of Health standards, those things. It's very black and white. Either you meet the standard or you don't meet the standard. And, so there's a lot less gray area there. So it makes our job actually a little bit easier, right?
mm,
Where it becomes difficult is on the clinical risk management side. We're focused on really making sure our partner practices have the processes and documentation practices in place to, in the event that their clinical records are requested or inspected by a third party. And sometimes you get pushback, get a lot more pushback there, and we've been pretty successful over the past several years, but it does there in that realm we do get some pushback, but and that's okay. We're okay with that. There's some things we can live with, and some things that we really stress that really are not negotiable. But for the most part, everybody's on board. And I think it goes back to how we've framed our work.
Thanks, Tony. Mm-hmm. We've heard a little bit about how you convince control owners and practices why compliance matters. What is your why behind compliance?
What we say is that, we're here to keep your doors open, right? We don't ever know. In most cases, we don't know when an inspector is going to show up, right? And by going through this process, it might take an hour, it might take 2 hours, but at the end, when we've got everything solved and your risks mitigated, if you will, you're going to sleep better at night. We're going to sleep better at night, knowing that if an OSHA person came in tomorrow, they would leave. Because there's nothing to look for. Like, that's really how we describe it to the office managers who really, what is this? Why am I going through this? What does it mean for me? And that's really how we've described it. And to be honest, throughout the process, we're now starting our third year of the regulatory compliance reviews. And I think the things that I didn't realize would happen is that a lot of our long-term managers in our network, the walkthrough process itself almost became a training session for them. So they become more or less an arm of our compliance department and help us spot issues, right? And when we make a point to allow them to report those issues very easily and respond to them very quickly on our end, again, it goes to creating those good relationships. And just further builds that trust that we're here to help support them.
It's almost like agents of change, in that decentralized model. That's one of the only ways that I think it can really, really be successful.
Yeah. It's been working.
Glad to hear it. Sounds like it really has been. And I mean, just to draw a parallel to all other industries, essentially your practices are your control owners. And whether, those folks are sitting at practices across the country or whether they're sitting in teams, across the world, it is so important to communicate the actual reason for compliance with those folks, because it's not their day job and they don't care unless you can explain to them the value of why they should care. And then hopefully if you do a good enough job, they actually become agents of change. And it seems like you've been able to achieve that, which is amazing.
Yeah, it's been really good. It's been a great experience. And again, I'm surprised. Going into it, I expected to get a lot more pushback than we did. And I think that just tells me that we've framed everything correctly. The other thing we tend to bring up, we, like most organizations, there are OSHA inspections that go on, and when we can talk through sort of what the burden of going through that process is for the manager, and doing whatever's necessary to mitigate or minimize the impacts of an inspection visit, really creates a lot of buy-in to the process.
Preventive, it's real painkillers, not just nice to have vitamins, as they say in the software world. Awesome. Right. I want to start talking a little bit about compliance automation. And I know that you had implemented a little bit of automation, I think, right when you walked in the door at Specialty1 Partners. And obviously, you've now looping in AI agents and the work that we've been doing together. But can you talk a little bit about where you started from and the initial layers of automation that you built in?
Yeah. So when we started, most of our regulatory compliance side was outsourced to an outside vendor. And just on top of the framework that I described before, just in terms of how we're a resource and conveying those risks that we do know of, and in a decentralized model, centralizing that risk into a digestible format to be able to present to the board, to present to the executive team, so on and so forth.
Yeah.
We had zero visibility into that sort of framework when I got here, so we moved off of that outsourced vendor and developed our own internal process. And initially, our focus, I mean, there really is no, I don't know what the right term is, no sort of plug and play option for this kind of work, right? So, or instruction manual. So what we originally came up with was basically a risk weighted scoring process for our offices. And so we would conduct our reviews, whether they're clinical risk management reviews, regulatory compliance reviews, those sorts of things. And in the end, we would, do a little bit of math, come up with essentially a grade for them, and convey that grade to stakeholders. And in that, surprisingly, for the offices and office managers and operators, they liked seeing like more or less a report card for their office. So it was nice for them to see, like, you got a 78% in this category. That's a C. I don't want a C. I want an A, right? So that process was pretty effective in terms of getting buy-in to the process, but it didn't let us. We were not able to take those risks that were identified at the local level and again sort of roll them up and be able to convey effectively what's going on in the offices. I can tell them what the scores are and what the average scores are, but if someone were to say to me, what is the issue, that one issue driving that region's score down, it would take me days to figure that out. Right.
And is that useful? You're talking about kind of course, the offices get their scoring, but you needed to be able to tell and kind of synthesize that information up, not only for executive management level, but also for a second or intermediate regional level. Is that right? Look, there's multiple levels in which you need to be able to kind of grab that information and be able to share it.
Exactly. That's a great point. Right. So at the executive level, obviously it's pretty high level information that we wanted to be able to share. And I think those percentages got us to that point. But when it came to sort of the mid-level management, and they would say, what's going on in this office that I need to address? It took a long time to kind of figure out what those things were across a particular, like a regional, particularly as a regional director. We weren't really able to deliver. Here are the things that are going on in your office that are a problem. And maybe we're not getting buy-in from the office manager or whatever. They might be having trouble solving a problem that we can't help them solve, or we need them to solve for us. We really didn't have that level of visibility, which really drew me towards looking for a different way to carry out our work.
Interesting. And so you started with some automation before you started partnering with us, right? Can you talk a little bit about kind of the step of automation that you took initially and maybe the value that it brought to your team?
Yeah. So when we had sort of the more or less the report card style of reporting, the inputs or the findings would be input into this platform, and it would spit out a grade for that particular. So we would put our inputs in for our OSHA walkthrough, and it would tell us what the score was for that office for OSHA. And then it's had I want to use the term dashboard loosely, but I could go in and I could see, okay, at the first round of reviews, the office had this score. At this follow-up, when we followed up with them, their score changed to Y. And then when we did our annual review again, what was their score was Z, right? So that was really the level of automation we had. And then you could break down those scores by category, by region, by director, so on and so forth. But again, the piece that we were missing that you pointed out when we first started talking was within that score, what's driving that score? What are the true issues there? And again, we could put our finger on it, but it was not nearly as efficient as it should be.
Hmm. And then can you talk a little bit about, when we first met, you met our team and I mentioned it in a LinkedIn post recently, but I was pulled into the conversation because our team said, "Hey, I think we may be able to help Specialty1 Partners, but this is not a use case that we have worked on before
Mhm.
specifically. And can you come in and provide some guidance and counsel to the CCO?" And I said, "Sure." I remember coming into the call and you showed me your current automation and you said, "This is what I've got." And I, again, kind of said, "Okay, maybe we're not the best fit." But you actually said, "No, I think this can work." Can you tell me what prompted you to feel that way?
I think when you talked to me through, and I think we sort of anecdotally knew we had this gap in our reporting capability. Like what's driving that score, and in office by office, region by region, we could not tell that side of the story. And when you pointed out that this platform can tell that side of the story in terms of moving our focus away from this scoring to a more, I don't know what the right term is, just more or less a risk, like start recording your risks and tracking those. Don't worry about the scores. And when you said that, sort of light bulb went off in my head. Like, okay, this I think this might solve our our vision problem here.
Mm.
And I think it just took some time for us to kind of brainstorm on how we would carry that out in the platform, not knowing 100% of the platform's capabilities, but knowing, okay, this might work, right? And we might get the visibility we need here.
It's interesting because, like so many of our other clients who have leaned into AI sooner than I think the market has,
Mhm.
what you just told me was basically that it's the value that the tech brings. It has nothing to do with what the tech is. So it didn't matter that it was AI versus automation. It just mattered that you were getting visibility and risk based reporting at different levels that you didn't
Mhm.
previously have. Is that correct? Or was there something about the AI and agentic AI portion that made you want to lean in anymore?
I think I think the former, what you've described, the former is probably what sealed the deal for me. And the AI was really when we talked through that capability, I really saw how much more efficient our processes could be if we leaned on that piece of the compliance platform. I'm always my framework really day to day really is, what are our risks and where are our risks and what are we doing about them, and sort of encapsulating those two questions around kind of value creation, right? You don't really hear about value creation and compliance very often, but we want to create value by, like I said before, allowing the office managers and the operators to spend more time growing the practices and taking care of patients and less time worrying about compliance, right? That's our sort of value creation ticket, right? But then the next question is, how do I show that? Am I creating value? How am I creating value? And where am I creating value? So that I think the value creation piece comes twofold, right? We can accomplish a lot more in our department through the AI, using the AI piece,
Mhm,
right? And I think that drives value in our department.
mhm,
Secondly, the value creation comes from being able to show that here are all the things that we identified in all of our offices, and here are all the things we helped those offices mitigate, right?
mm.
And so it's really been super helpful both from a departmental standpoint and from a compliance program standpoint, to be able to tell those stories.
Hmm. I really like the idea of that value creation ticket. That's a really nice framing because you're so right. I think compliance is too often thought about as a cost center rather than a value center, when I truly believe that compliance actually enables the business to take risks and make decisions about the future. And it
Mhm.
can be such a strategic partner if compliance leaders have the time and the visibility that they actually need in order to play that role. And I
Mhm.
feel that so often a lot of compliance teams are just overstretched. They're lean, they have to be. And so
Mhm.
they lose some of the visibility because they're just focused on getting the work done, and the work has to be done. And I think
Yep.
that's something that, the work has to be done. Compliance work is non-negotiable. And
Right.
so if the work has to be done and there's lean resources and you may be working in a more manual way, all of the time has gone towards that. And I think, as you know, one of the biggest things we're trying to advocate for is saying, look, how can we reduce the manual tasks so that
Yes.
the same resources can just focus on different things rather than focusing on the manual, and then ideally can get their value creation ticket more quantified or more, what, I don't know what the right
Yeah.
word is, but more tight, more tangible maybe is the right word.
Yep. Yeah, I agree. We budget from a budgeting standpoint and time management standpoint. Today, we budget about half our time across the department just in communication and reporting.
Mhm.
And well, that's super important, and you can't go without that for the reasons we talked about before, right? It's not, I don't, that time is not value added time because that means for every hour my team is spending identifying an issue, identifying a risk, and conveying that risk to the office, that means that's an hour of their time not in an office looking for those things that need to be corrected. So the more time we can shift away from sort of, for lack of a better term, administrative work in the department and more towards working on those relationships with the office managers, building those relationships and helping them identify and mitigate risk, the better we're going to be.
I know one of the key features of the AI agent that you guys are using is to essentially do some of the manual review of questionnaire responses and be able to float up, hey, these are actually the gaps, which lessens the load on the manager having to kind of do that manual work and instead can
Mhm.
just focus on the gaps. How much time do you think that's actually saving?
Um, today I think we're a little bit better. I haven't quantified the administrative change, that
Mhm.
at least the increased efficiency. But I know it's just in terms of the communication, our process to communicate findings to the offices, kind of generate those findings in the platform and communicate them to the office. We've saved a fair amount of time. I would guess we've shaved an hour, maybe 2 hours off of that time
Mhm.
per report. And again, I'm really focused, like you said, I'm really focused on shaving more of that time off. Like you mentioned, we're a lean department. We're also a growing company, and so like most people out there in the compliance world, we're always trying to do more with less, or want to do more. We know a lot every year. We see, oh, there's a risk there. I want to get that addressed, right? How do we do that? Right? And it becomes a time management problem that we have to solve. So I really am hopeful that we can continue to shave time off of that more or less administrative work.
Just moving to kind of your earlier adoption of AI, just out of curiosity, what fears do you think other CCOs have about implementing AI, and what would you tell them?
Yeah, that's a great question. I think, just generally speaking, I think the term AI it means different things to different people,
Mhm,
right? And unless you really understand what problem you're trying to solve,
mhm,
it's really hard to sort of contextualize what an AI platform could do for you. If you don't have a problem you're trying to solve, it's almost impossible to kind of really go down that path. So I would say, if just in terms of advice or um, guidance on that topic, like the number one thing is what problem are you trying to solve? In our case, it's the risk visualization
Mhm.
and the administrative burden of reporting our findings to the office. Those are the two problems we are trying to solve. And the problems for other CCOs might be different, right?
Mhm.
And the don't be scared of the term AI, because it's probably an a again, I'm using I don't really like that term, to be totally honest, because it does mean different things to different people, but I would call it automation, right? Work automation. There is work automation that can be adapted to your workflows and cut into and used to solve some of those problems that you have.
Just kind of goes to what we were saying before, which is that, it's not about what the tech is. It's actually about the fact that it's creating value and it's solving specific problems. That's what actually
Yeah.
matters more so than the fact that it's AI or not. But yeah, I think that was very well said. You got to really
Yeah.
know what your problem is and then assess all the different ways that it can be solved. I think that's kind of the idea behind that idea of custom agents. But I hear you that sometimes it's not the AI part that matters. It's just about custom solutions, is really what it is.
Yeah,
Custom
yeah.
automation.
There was a guy I used to work with, a vendor that I was pretty close with, the last company I worked with. And every call I had with him, he would say, "Okay, before we get started, what problem are you trying to solve?"
Mm,
And
that's great.
that really stuck with me, because that problem, clearly articulating that problem, can help you find a solution, uh, a solution that's going to work for you. And and then the next question I ask myself is, what do our outputs need to be? I think a lot
Mhm.
of people focus on the inputs first. I want to focus on the outputs, because my output need in this case was that reporting, right? We have a decentralized process, decentralized company, and I need to centralize the reporting. How am I going to do that? What do I want that to look like? And then I sort of work backwards and figure out, okay, how do I structure my inputs to
Mhm.
meet that output need?
Yeah, that makes complete sense. And
Yeah.
one of the outputs you were, of course, going towards was risk visibility, right? I know we
Yep.
discussed that a little bit. We've talked about it a little bit today, but just going back to this idea of how do you think that risk visibility links to business decision making?
Hmm. That's a good question. In terms of, I don't know if I think of more in my line of thinking is more strategic sort
Mhm.
of decisions. Um, and I think the day to day stuff that we deal with are relatively simple problems to solve. Nothing systemic or particularly earth shattering, right?
Mhm.
They're relatively simple problems to solve, and they're rooted in just operational lack of awareness.
Mhm.
And we bring that awareness, or just a misunderstanding of how things are supposed to go, right? But in terms of like larger decision making, I think, at least in my role as a compliance officer, it has been like, if I have a concern about that decision, I'm gonna try and articulate my concern about that decision as clearly and concisely as I can. And I'm not that decision maker, but then I've done my due diligence as a compliance officer to say, hey, these are my concerns. But I also try to come to the table with a solution
Mhm.
to those problems if there is one, right? Sometimes there's not, right? Like it's really sometimes it could be very black and white, but there's,
Mhm.
as you probably know, there's a lot of gray area in compliance, and articulating that risk in a way that is understandable by the operations people, particularly when you accompany it with a solution,
Mhm.
seems to help.
Yeah, 100%. I mean, it's interesting what you just said because you were almost looking through the compliance lens more than the risk lens, I think. Because when you were thinking about, contributing to the strategic decisions of the company, almost reviewing it for risk, reviewing
Mhm.
it through a compliance lens for risk, which is very valid. I think one of the other things I was kind of curious about is that, as you can see more of the risks for your organization through
Mhm.
more automation, basically like having a little bit more time and headspace and peace of mind to think about the next level of strategic risk. Do you feel like that ties into your ability as chief compliance officer to think more about the strategic decisions of the business, not only in response to a potential decision, but almost to help, I don't know, lead some of those or guide some of those decisions, as a key input. Does that make sense? Does that question make sense?
I think so. I think so. And as we mature in the compliance platform and we see trends in risk areas, or sort of secondarily to that, trends in other areas, mechanisms within our compliance department,
Hmm.
you know, we're focused on sort of solving that problem.
Hmm.
What is that problem at that office or this reported compliance policy violation concern, whatever it might be, right? We tend to get hyper focused on that. And one of the things that I was thinking through the other day was, gosh, we're 3 years into our chart review clinical risk management program. We're entering our third year of our regulatory compliance program. We see now that we have the visibility that we do have, we see a lot of the same things. And while I talked before about training, like one of the byproducts of our regulatory compliance and chart review process, for that matter, is really ended up training the managers to sort of be an arm of our compliance department.
Hmm.
But at a bigger picture level, you know, I'm trying to figure out now that I have that visibility, okay, these what do we need to do as an organization to solve these problems permanently at the
Hmm.
organization level, right? And I don't know if I have an answer to that yet, but that's where I'm thinking. That's what I'm thinking about now because I would like to get to the point where we do one of our reviews or our walkthroughs. Maybe it's our third walkthrough of an office, and we don't find anything. Like they're ship shape. How do we get there,
Hmm.
right? Um, that's a really difficult question to answer, um, especially in that context, right? There are other things that we can work on from a compliance standpoint that I'm sure a lot of compliance officers can think through, but that you can solve at the organizational level. But there are some that just sort of, I guess, for lack of a better term, just sort of linger out there, and you want to be able to solve it without deploying continued resources towards it.
Yeah. It's interesting because I feel like over our conversations and partnership, I really felt like I understood, what you needed next. Like that really felt like I understood the landscape of compliance, especially to on partners. And this conversation has made me realize how much more there is to be done, even just from our partnership. Like there's so many things that you're talking about just in the last few minutes, even where my mind is going into, all the ways that tech could enable you to spend all of your time focusing on that because there's all of these enablers to that make it easier to understand that. So just an example, like better trending of risks over time, right, is just something that would directly enable, like, okay, great, this year, this quarter, this whatever time period, we saw a lot of this type of risk coming up, and now because we've taken these actions, we've seen demonstrably the change that risk has had over the offices, and now we're focused on the next thing. Like that's such a powerful sort of future with tech,
Yeah.
which enables leaders to really have visibility in a way that right now is so nearly impossible with things being as manual as they are in most organizations.
Yeah, that's exactly right. And that was my long-term vision for the prior platform to have, you know, who going back to that scoring methodology that I talked
Mhm.
about before, over time, who's improving and who's not improving, which regions are improving, who's not, where are our offices that are going backwards,
Mhm.
for lack of a better term. That's a very challenging thing to do as your risks change,
Mhm.
because you're measuring essentially a day in time, when you walk through these offices or do a chart review or whatever the case may be, right? You're evaluating that office on that day. And when you visit them a year from now, they're the risks that you want to apply to that location or chart or whatever it might be are going to change,
Mhm.
will likely change, right? So to do that over time becomes, I've thought about this a lot, and I can't figure out a way to do it. I can't. I want to your point, I want to, because I want to be able to show that big picture wise, centrally, as a compliance department, we're lowering our risk
Yes.
across the network over
Yeah, of
time,
course.
right?
Yeah.
And
Talk
it's a
about value
really tough,
creation ticket.
it's a tough thing to do.
Yeah. But really, that is the value creation ticket, isn't it?
Yeah, it
Yeah.
is.
Really
It
quantified
is.
as well. It's interesting because I see the path to that. I don't know exactly what it is, but I know that it's possible. And it's interesting to hear you talk about it too, because we work with all different types of companies and all different sectors. And healthcare compliance, and especially practice-based healthcare compliance, where you have such a, as we said, decentralized network that you are responsible for, it it poses such interesting challenges compared to something like a tech environment, where at the end of the day, you can have continuous monitoring because you can hook it up to the cloud
Yeah.
hosting environment, and 24 hours a day you can check exactly what the configurations are and whether security controls are in place. Of course, there's a lot of stuff that happens
Hmm.
just human to human or in physical environments, but you get a pretty good coverage. But when it comes
Yeah.
to healthcare compliance, it's a totally different ballgame. And health practice
Even
compliance and dental practice compliance, totally different ballgame.
Yeah, totally. Even from acute care, right? In acute care, you're looking at the work plan, OIG work plan. You're vetting that work plan against key stakeholders. You figure out what components of that work plan are applicable to you.
Mhm,
As a compliance committee, you decide which things on that work plan to add to your work plan for the year. And if
mhm.
all goes well, you can organizationally say, look, these are the things that the OIG says are important. We've looked at them here and we're good,
Yep.
right? We have none of that in dental, right? It's not there. So we can't go, we don't, the ability to go to the board and say, this year we've taken these high risk things and we've evaluated them and we're at low risk. We think we're at low risk. So as an organization, we're great.
Hmm.
It's not
It's
there.
um it's so funny because sometimes I feel about compliance in general, the stakes are so high and the visibility is simply so low. And in no other part of a business do you get such a wide remit. Like compliance covers all business activities at the end of the day.
Mhm.
You have such a wide remit. The stakes are so high. But the visibility, it's not for lack of trying, it's not for lack of intention, it's just for lack of what's realistic. You can't
Yeah,
you can't interview every office every single day, obviously. You can't
right.
have someone there every day, obviously. So it's just so interesting. Like, I'm curious what the future of tech is going to hold for, healthcare compliance in particular. I think we have some ways that we can go though as well to push ahead, I think, a little bit more. And honestly, Tony, I think you should do more talks about healthcare compliance because I learned so much from this
Yeah.
conversation. And I really did.
Well, I
I
appreciate
feel
it.
like you just distilled down so many things that are real challenges for decentralized compliance, for healthcare compliance. I just wanted to say that.
Thank you. I appreciate it. I like the work, and it's fun. Like I said, in dental, there's none of this stuff's around. Like the OIG work plan doesn't exist, right? Nobody's out there telling us what our risk theories are, right? And so we have to come up with our own way to figure out where those are, what they are, and where they're at, and how to get them solved. And I enjoy that problem solving.
Well, you can tell. And I think there's some, lessons that you've shared today that are super applicable across different industries. And they're so applicable across different industries that I feel like, it's not only limited to healthcare compliance that you should be sharing some of these, but just the two things, especially from today's session. One is around, you know, the messaging to, again, essentially control owners about the why behind compliance and
Mhm.
why should they care? What is the value that you're providing to them with this? Maybe in your case, as you said it, so that, they can keep their doors open or OSHA can come in and OSHA can walk right out without any concern because there's nothing to find. But it
Mhm.
translates quite directly to compliance teams at a tech company, at a manufacturing company, just saying, hey, control owners, this is what I need from you. You're the first line of defense at the end of the day. And
Mhm.
I need to do these things so that when someone comes knocking, you can just continue on with your work. This is just
Yeah.
a preventative painkiller.
Yeah.
And the second thing which I really liked is, you know, breaking down and saying, hey, you don't need tech until you can articulate your problem. If you have a problem, then go and seek tech and automation and figure out how to fix it. You need to be
Mhm.
able to articulate it first. And then we can figure out whether it's automation, tailored automation, custom AI agents, whatever the solution might be. But
Yeah.
unless you're doing that first, you're not going to be able to figure that out.
Gotta have a problem
Gotta have-
before you find a solution.
yeah. Any
Right?
final advice or words, Tony, from your side?
No, this has been great. It's the first time we've done this.
It's been, again, you're a natural. You should do it more often.
Well, thank you. I appreciate it.